Welcome back to the Robaer Report. It's Monday night again, 8 o'clock Eastern Standard Time. Of course, my name is Robaer. I'll be your host today for the Robaer Report. And as always, we have a special guest to learn about, the mission of this show towards their life, individual groups that and what their contribution is to society and its development. So today is the last Monday in the month of February. It is also the last Monday in the month of February, Black History Month. And it is lastly the last Monday that we will focus on mental health for the month of February in commemoration of Black History Month. So today, I have a guest here by the name of Dr. Bruce Tisdale out of the DC, Maryland, Virginia area. Dr. Tisdale will explain to you about what he does in the field of social work. And I am going to put up the link, as I always do, for the suicide prevention. First, I'll start with if you're in the Baltimore area, need help with life struggles, please call this number. Someone will be able to talk with you. And it's important to get help, mental health support, particularly during this COVID-19 pandemic that's taking place, that's ravaging our world and our society. There's a number in Baltimore to give a call to if you need someone to talk to. Let's get on with the show. So we have a practicing licensed social worker, a counselor, a therapist here with us today. Dr. Tisdale, how you doing today, man? How you making?
I'm doing well. Thank you for having me.
Okay, great. And we'll jump right into the show. I back in November 2020, I was on a conference call for the Office of DC, and that's District of Columbia, Fathers, Men, and Boys. I was on a conference call where the topic was supporting men in the family law arena. Whether they were trying to get custody, issue with child support, trying to get an attorney. And one particular area was regarding mental health. So I was saying, hey, how does this fit into this narrative that we're discussing today regarding men being supported in the family law arena? And Dr. Bruce, I call him Dr. Bruce, Dr. Tisdale, he spoke, and I knew that he was there for a purpose. So, Dr. Tisdale, why was it important for you to be at that gathering that day in a family law setting? Just for those who have no clue about, what you do.
Sure. Well, first, thank you for just inviting me to this opportunity. I want to commend you for doing a good work. I can attest that you are a brother that has a genuine heart and desire to help and share good information with others. And this platform that you're on is doing just that. So I'm really excited about this opportunity to come and share tonight.
Great.
So
Thank you.
I guess to try to answer your question, I was invited through a colleague that I had did some shared work on over the last maybe 10 to 12 years as a case carrying social worker during that time. And so she felt, given the purpose of that particular event and my past experience, and I'm a Black male, Black social work male, that I could perhaps relate to the topic and the audience that we were hoping to address during that particular event.
Okay. And with that explanation, it actually leads into another question that I had. And that question, you can call it a two-part question. In the field of mental health, and in particular in the field of social work, why would you say it's important to have men in that line of work, and in particular men of color?
Mm-hmm. Well, I could talk about my experience again, or related to my experience as being a case carrying social worker when I worked in child welfare. Majority of the first part of my social work career, I worked in child welfare in both Maryland and Washington, D.C. And a large percentage of the families that I served, they were absent of fathers. In fact, when we were looking at trying to find what's called permanency for children, whether it was reuniting them with their caretaker, oftentimes that would be a mother or a maternal figure. Um, Fathers or paternal figures are very rare, rarely involved. That's not to say that they aren't, but in terms of taking on a primary custodial role, you just didn't see that, at least in child welfare.
Okay.
And I think, given my experience as a Black male social worker, I've been able to really ask the simple question, where's dad? Um,
Mm.
because just because they weren't involved doesn't mean that they did not want to be involved.
Wow.
And so, just by simply asking that question, we were able to uh, bring those dads in, or those paternal figures in, so that
Wow.
they could have some involvement in their child's life, even if they weren't considered a viable permanency option for their child.
Okay.
Uh, and then, I have my own story. It's not necessarily one of child welfare, but this is personal to me. I have three children where each of those situations are very unique, and it caused a lot of distress. My story is one where the courts, they asked the question, well, where's mom? And
Mm.
gave mom the benefit of the doubt, even when mom didn't show up. And it was clear that she was not going to be involved. Um, and so I noticed the biasness of the systems. And so I've really dedicated my career to making sure that fathers or paternal figures have a voice, particularly those of color.
Okay. Okay. Wow. So similar to an expression I've heard before, where they say giving a voice to the voiceless. Would that be something that you could see yourself have identified with that expression?
Yeah, absolutely. For many good reasons, fathers, don't want to get caught up in this process, right? But it's necessary that they have representation
Okay.
that lifts up their voice and honors their contributions that they bring to the lives of the children.
Okay. Wow. Doctor Tisdale, I'll call you Doctor Tisdale for the. Oh yeah, let me do this real quick, 35 seconds. We are live streaming to Facebook, YouTube, and we're newly live streaming to Twitter. That information just came across my desk and a few of other people on our network desk, that you can actually live stream to Twitter. So we're on Twitter as well. Check us out, Black USA News on Twitter. We'll get back to the show. All right. So one thing that did impress me about meeting you was that you graduated from Howard University. That's my undergraduate. So I'm a full-time son. I graduated very well. I had a good GPA. I don't have no hard feelings. And when you told me that, I was like, wow. I've always walked past that social work building right on the corner. You have to pass it coming into the campus, but never really gave it any thought. Never, and not because I didn't care, because it's because I didn't know.
Right.
And that building means a lot sitting on that corner. Let me ask you this. So I know you're LCSW. All right. And what other social work designations do you hold for the field? And so when I say that, what designations do you hold? And also as a way to share with others who may be interested in learning more about going into social work, what are some of the different paths that they can take?
Mhm. So I guess maybe let me just back it up a little bit and share what my educational journey has been and how it has landed me where I am currently. So I have an undergraduate degree from my undergraduate alma mater, Bowie State University, in psychology. I actually have a bachelor's of science from Bowie. Then from there, I've always known that I wanted to go into counseling.
Okay.
And so, interestingly, you would think that I would have gone into counseling for my master's. But the guidance that I received in undergrad was to go the social work route.
Mm,
Because as a social worker, I could do all things, as we refer to it in the field, right? So
okay.
case management, counseling. I think our class president at the time, was a principal of a charter program, and many other things. It wasn't as limiting
Okay.
as potentially a counseling degree would be. And so I went on to Howard University, where I obtained my master's in social work. From there, you have to obtain a license in order to work technically as a social worker. And so
Okay.
I was licensed as a licensed graduate social worker right out of grad school. I did that for a few years because it took me a few years to get my independent license clinical social work, but I got it right,
Okay.
and I plan on keeping up my hours and my training, paying them hefty fees every 2 years.
Hmm.
And so that led me directly into case carrying social work, as I shared earlier,
Hmm.
particularly in child welfare. From there, I simultaneously started working in an outpatient mental health program as a therapist,
Okay.
doing house calls to
Mm,
children and youth, and very few adults at that time. Again, I always knew that this was the path that I wanted to go. But then I got into emergency room, doing some work there, PRN. I've worked in government on a macro level around policy development and agency organizations. Um, and then all that time I was developing my private practice.
okay.
And so in August of 2015, I officially applied for my business license and made it official, and we've been going strong. Now I have a
Okay.
practice now of um, at least 8 clinicians working
Mm,
alongside me, several master level interns that also have come through my program and currently working within my practice. And so we've,
Dr. Bruce, I want to
uh-huh,
stop you real quick. All right.
sure.
Because you just said something that was powerful. I mean, you experience it every day. So I don't know if you realize how powerful it was what you just said, but in 6.5 years, to August 2015, is that date correct?
Correct.
It's tomorrow will be March 1st, 2022, and you work alongside 8 other clinicians
Mhm.
and you have master's degree or master's seeking students operating with you all in this field of mental health. Is that correct?
That is correct.
I mean, that is so powerful because that is you just said that you went down to get yourself a business license. That's very important, for the paperwork side. You already had these experiences on your academics and as well as professional. You melded or gelled the two together to create a source of income for yourself where you're actually helping the community out. Is that correct?
That is correct. Yes.
Wow. Okay. That is a topic that is rarely ever discussed by
Yeah.
you're a black man and working with 8 other people as clinicians, and you have people who are working with you who are master's degree or master's degree seeking students, and you all are working with people to help out in the mental health field. That is so powerful. I just wanted to state that. I want you to continue what you were saying, but I wanted to highlight that real quick.
Yeah. Yeah. Absolutely. Yeah. I guess when you put it like that, I don't. I mean, yeah. I mean, we've done some amazing things over the last 5, 6 years, right?
Wow.
And so our focus now is really to step into our mission and our purpose, and that is to serve individuals that are reeling from the effects of childhood trauma
Okay.
or early adulthood trauma.
Okay.
Or any other life stressors that they continue to struggle with. And so we try to provide a very specific approach in our work
Okay.
with our, have kind of gotten away from the young children. Still
Okay.
get those referrals to slip in from time to time. The referral sources know how to smooth me over, and my heart.
Okay.
My heart,
They got you.
they still get me from time to time. It's hard to say. I no longer work with children,
Right.
but I try to focus more on adolescents, young
Okay.
adults, and older adults.
And tell me, you trying to graduate too, man. You trying to, build it up. That's all right. That is awesome. That is so
Yeah,
awesome.
yeah,
Dr. Bruce, that is so awesome what you're saying to my audience right now, to this audience. And once again, we're streaming on 3 platforms: Facebook, YouTube, Twitter. First week on Twitter, and we have wow. I'm blown away because you've kind of taking something whereby. So my mother, I'll start with that. My mother, I always thought my mother was a social worker, but she was never a social worker. She never said she was a social worker. She worked for a social work organization, a community social work organization, actually 2 of them in my hometown. She was a case manager and she did case manager work. But I always, growing up, thought she was a social worker. And I asked her one day, she said, "No, I never said I was a social worker. I'm a case manager." And so I thought that the work that she was doing was social work. I mean, it is, but she was just a case manager. And then when I say, I'm not limiting that, I'm just saying she was only operating as a case manager. When I found out what social work actually was, I was 21 years old, 22. I was at Howard myself, and I met a student who was in the social work department. And she began, because I was helping her with develop some of her papers. And she began to help me understand kind of what social work was at the time. All right. She mentioned this thing called 3,000 hours of clinical supervision. All right. In your 3,000 hours, like, were you able to do it like straight, or did you chop it up, have to take a few years off, come back? How did you do your 3,000 hours for those who are listening who may be wanting to go into this field? How did you manage your 3,000 hours?
right. So what you're referring to is the postgraduate level requirements towards becoming independently licensed. Uh, and so those 3,000 hours for me came very easily because I
Okay.
was working 2, sometimes 3 different jobs.
Wow.
And so my clinical hours, direct clinical hours, added up in just a little less than 2 years. My
Wow.
challenge was passing the clinical exam. Right?
Okay.
I never realized that I had such anxiety until it came to that exam.
Wow.
So it took me a little time to find the recipe to get past it. But like I said, once I did, that was it.
Okay. Okay. That's important that you brought that up about the test because how can I say this? It can be this. You can receive literature about the field, and you can also receive literature about going to certain schools and getting your degree. But when it comes time to taking that big test that you have to take to be proven in the field, sometimes all of that work that we've done, it doesn't measure up because we can't pass that test on the first time, second time, and I'm sure some people are taking it three, 4, and 5 times.
Mhm.
So to hear that you can openly say that you had a difficulty surrounding that test, I appreciate that, and I'm sure this audience does as well because you're opening them up to some of an issue that they could face in attempting to attain the LCSW status. So
Yeah.
I appreciate that. I have another question for you. So when you have consultations with your clients or you're doing your work, I'm sure you since you work with 8 other clinicians and you have other staff, I'm sure that you talk to a lot of people during the week. And when I say people, I mean clients. And with so many clients, how do you manage in regards to self-care? How do you manage to keep going when you have a 9 to 9:50, and then a 10 o'clock to 10:50, and then a 10:50 to 11 o'clock? How do you juggle? How do you manage that time? How do you take care of yourself when you have if you have that type of schedule that you work with?
Mhm. Well, that's an area that is still very much a work in progress for me. Excuse me. But I am trying to be intentional with being okay with owning my free time.
Okay.
I am one because I've always worked and worked hard, uh, have found it awkward or difficult when the weekend comes and I don't have to work, for example, right? Or if there is an hour in my schedule and I have no clients, no other paperwork to do, just
Mm,
leaning into that time and appreciating it. That is still
okay.
something that I find myself trying to be okay with. Some days I am, and other days not so much.
Okay.
But other than that, I am very regimented with my schedule. So, for example, I get up every morning at 3:10 a.m. and do
Okay.
at least a ten mile run or workout, 10-mile workout of some sort. And that takes me, a good part of 2, maybe sometimes 3 hours if I lift weights. I'll get my meditation and scriptures in after that. Make sure I eat my breakfast, take
Wow.
my vitamins, right? I don't take calls or texts first thing in the morning because I just feels that kind of sets my day in a direction that's not very helpful for me.
Okay.
Uh, and then I just try to own my time throughout the day and be okay with saying no.
Okay.
Again, that's still an area that I'm working on, but I'm being more cognizant and intentional about it every day.
Okay. Okay, okay, okay. Wow. So you have an entire regimen set up starting at 3:10 in the morning towards building for your day so that you will be able to be operate at your highest capacity for your clients and for your coworkers. Is that correct?
That's correct. Yes.
Dr. Tisdale, it looks as if you really have a heart for your field. I mean, because you're taking the necessary steps to take care of yourself, and because you're strong, you're able to take care of your clients and your coworkers and your family that you have. So, man, you have come and dropped some real, in just a few short moments, you've dropped some real jewels on our audience, because it's not every day that a person gets a chance or even seeks out to listen to a social worker or anybody in particular in the field of mental health outside of that specific practice, or going to their office, or to see them for whatever, for any of various reasons. But just to listen to someone who's a professional in the field explain with such clarity, I think this is a real gift to our audience. In particular, our last Monday here for mental health for Black History Month.
Mm-hmm.
And so, so you mentioned Howard, for master's degree and for your PhD. Is that correct?
So I actually have a doctorate in social work and not a PhD in social work.
Okay.
But I obtained my doctorate from Capella University, an online university. Yeah.
Okay. Wow. Okay. And so so my next question is surrounding how you interact with your coworkers in your work environment. All right, it's a C-19 COVID, however someone wants to explain it, wants to say it. So when you all are working now, all right, are you all always meeting in the office with your patients, or are you all doing online work, virtual work? How do you all how do you manage it with your patients at this moment?
So with our clients, we are about 97% virtual. There is still a small percentage that is telephonic, but by and large, our sessions are virtual. We do have maybe about 3 clients that have requested to come in the office based on comfort level of myself and the other clinicians. We have accommodated that.
Okay. Well, Dr. Tisdale, is there do you all have a website that I can possibly pitch up for people who want to seek you out
Sure.
for your support?
Yeah, absolutely.
Okay.
It's Hope, HOPE, the number 4,
Okay.
YOULLC.org.
.org.
Yep.
So
Yeah.
I'm going to put this up on the screen. I'm also going to write in any information that you're comfortable sharing with me into the chat, so that people can reach out to you. If you have any information that you would like for me to put into chat, I can do at this moment.
Okay. Or they can just call me directly. One of the parts of our mission is to offer convenient access to mental health treatment. We don't want we want to try to remove any barriers that may exist for someone.
Okay.
Sometimes particularly people of color, we may have been thinking about reaching out for help at some point. And, we feel like, well, this isn't the best time. It's late at night. If you text me, I will respond. That is a cell phone number that you see there. If you shoot an email, you will get a response. So, there's more than one way to reach out, is my point.
Okay. Wow. So for those in the audience, this is a brilliant website. It has contact information at the top as well as bottom. You can find hopeforyoullc.org on Facebook, looks like this is Twitter and Instagram. Facebook, Twitter, and Instagram. They also have on here the hours that the office is available, as well as they may be open on weekends by appointment only. This is awesome. At the top, you can submit your referral for your interest in working with this office. And in the middle of the page, near the bottom, they have a services tab. I would suggest for those who may be looking for some support or looking for a consultation, looking for a new home, if you can call it that, www.hopeforullc.org. Looks like a great opportunity for anyone seeking support. As I say, I heard Dr. Tisdale speak at an event, a virtual event, about a year and a half ago. Was really impressed, thought about it for a while. And when I got this show, I said, one person I am going to bring on to talk for today, as well as for the near future, is Dr. Tisdale. So thank you so much, Dr. Tisdale, for coming and sharing with us today about your experience in the field of social work. I know you say you get up at 3:10, so you up in a few minutes. So hopefully we didn't carry you too long. Lastly, go ahead.
No, it's been a pleasure. Thank you again for the opportunity.
All right. And before we leave, I will say welcome. Thank you to Be More News. Let me see, get it right. We had an award ceremony this past Wednesday in Baltimore at Collins. I was awarded one of the Joe Mann's Black Wall Street Awards. For those of you who are viewers of this show, the Robaer Report, I want to thank you all for viewing because someone called me and said that, hey, you have won an award. And I showed up, and for sure my name was on the plaque. So thank you so much. It will be my goal is to put it on the wall. I wanted to hold it up for this show today. My goal is to put it on the wall, and we can pull it down every now and then. But thank you so much again for gracing us with your presence, Dr. Tisdale. And you have a great rest of your evening and a great rest of your week. Take care, sir.
All right. You do the same. Take care.
Bye-bye.